Namaste. 3 days before, one female patient, around 31 age, she came to my hospital. She said she's a diabetic patient, diabetic mellitus, sugar. So I advised some blood investigations. You can see in the screen, C fasting, FBS is 229 and HbA1c 3-month average 7.6. Of course, both are higher. And one more test I done, insulin, fasting insulin, how much insulin produced in her body, that is 10.7. It's a normal, you can see here normal value, 3 to 25 fasting, that is a normal insulin level. So here you see she have a normal insulin level, sufficient insulin in her body, but sugar is not under control. Okay, that means that insulin in her body not working in proper way. How we calculate the insulin efficiency? One test called Homa IR. That is not a test actually, it's a calculation. We multiply FBS into fasting insulin, then we divided by 405. We will get a value. That value we call Homa IR value. Below 1.9 below, we consider it as safe. There is no insulin resistance. But in her case, I got 6.05, some more than that. So she is suffering with the insulin resistance. Her body insulin not working in proper way. Why that insulin resistance happens? Okay, the next question. There you can see lipid profile. See, cholesterol, total cholesterol 245, triglycerides 186, and TC bar HDL value you can see 5.2. That means she is not obese, but cholesterol levels are little higher and little central obesity. That means more fat deposit on her body. This fat deposit, adipose tissues, create inflammations, and sometimes the fat deposition produce some type of hormones, creates insulin resistance. Okay, there according to Ayurveda we consider this obesity as a disease, staulyam. So here we do staulya chikitsa mentioned in Charaka Samhita. Chikitsa means therapy also there, and oral medications also there. For her we given some oral medications to reduce the fat deposition in the body. Automatically the insulin sensitivity will improve along with the food and exercise, proper diet and some exercise we advise. So easily we can reverse it in this condition. Okay, this is a classical way of treating diabetic in Ayurveda. Depends on the condition. That's the reason we always advise you always consult a doctor, and then only you should take a treatment. Dhanyavad.